So I wanted to take some time, 10 minutes or less, just talking about your upcoming first lab exam in PTA 133 to help provide some framework for this lab practical. The good news is that the actual format of the practical exam reflects in many ways what you experienced in 132 for the lab exams, with the exception that we're talking now about the spine and trunk as opposed to an extremity. But the actual skill check is actually, in terms of the practical, is very similar. However, we have changed some of the point breakdowns to reflect the fact that you are getting ready for clinical, and that now, especially, we're going to look at specific areas of competency more closely to show readiness to start working with patients in really less than 6 months. So the foundation skills are familiar to you. We did remove vital signs because we're not asking you to check vital signs and found that language to be confusing to some students, so that has been taken out. You're still expected to be ready to be prepared for treatment, communicating with your proctor, which would be myself or Marcia, before you start your treatment, and to verify with us that there is no specific precautions or contraindications. We're not asking you to go through this with your patient, through a laundry list of precautions or contraindications to interventions to the spine, specifically because we're asking you in this exam to not perform traction. You're not going to perform manual therapy. It's going to be a collection of data and instructing in therapeutic exercise. So this is something you would do before you start with the patient with your preceptor or proctor, acting in the role of clinical instructor or a supervising physical therapist or director of rehab. So that is worth 5 points for this exam and for your second practical in PTA 133 lab. Communication is still weighted at 20 points. This has not changed from fall term. This is where there is a big point differential. So we've increased the points for your interventions to 55 points, so over half of your exam score is coming from your efficacy in use of clinical reasoning and providing interventions for the selected impairments that are part of the PT evaluation and that you're directed to address in your goals, in the goals that are set by the supervising physical therapist and in the plan for your treatment. Now this includes using appropriate goniometry, tape measure, and inclinometer measurements. Now in the case of the scenarios, each one of these patients are going to be measured with a either inclinometer or a tape measure at the evaluation. We're not asking you for this exam to use the goniometer, and we've talked about that in lab instruction. As to the why for that, the goniometry will come back for measuring the extremity, the shoulder and elbow, and specifically and the hand. But for this upcoming first practical, we're going to use the instruments that were used most in lab, which is the tape measure or the specific inclinometers or inclinometer, depending upon the case and what you're asked to do. So the intervention piece is really rich and really crucial here, that you really have competence in your ability to take range of motion correctly. Seen very strong evidence of that in lab, so I don't have strong concerns about that. Again, in your evaluation, it will specify centimeters, which would determine use of tape measure or degrees, which would indicate use of inclinometer/inclinometers, depending upon the impairment of the patient. And you're asked to do one stretching. So you'd be asked to take two measurements using tape measure or inclinometer/inclinometers for two impairments, whether it be decrease, for example, in this case, involving Kraft, we're looking at someone with a cervical strain, so those measurements would be related to the cervical spine. And then the other two cases are related to a low back pain. In the first case is a cervical as well, so two cervical cases and two low back cases. And then to select one stretching exercise for the impairment, whether it's restricted, specifically related to restrictive range of motion. For example, it could be limited ability to rotate the neck, in which case you would look at stretching the sternocleidomastoid muscles and other accessory muscles that may be tight, which would be looking at, for example, the upper trapezius muscles or muscle, and perhaps the levator scapula. But you'll get some direction with that in the PT evaluation, but also from your measuring, you would be able to show where there's a limitation and a need to provide a stretch, and then a strengthening exercise to address a weakness, as evidenced in the PT plan of care, as well as evidenced by the data collection of the supervising PT at the evaluation. And through your manual muscle testing, that this is an area that needs to be strengthened. For example, if a patient really struggles to turn their head to the side, but is able, in a grade 3 out of 5, you would look to provide some strengthening or some exercise to provide some increased movement going into rotation, if that is indeed the area of impairment of movement due to weakness. And then some posture education training, alignment of the spine, cervical positioning when standing, when sitting. So you really need to identify at least something related to posture and in terms of the discussion. Really throughout the treatment, not just a checkpoint. We'll look at posture right now, but you're talking about posture really integrated throughout the time you're with that patient. This red flag is something that we're going to continue to have just as a safety check if someone is having a medical event or is responding very poorly to treatment, that you would stop that activity. So that remains a red flag item. And the clinical reasoning piece is tied into taking the correct measurements based on the PT evaluation, what the impairments are, and then selecting the appropriate exercises to match the impairment, whether that's a stretch or a strengthening exercise. So that, in a nutshell, covers what we're looking for. Just looking at the case of one of these, we are not providing you with the evaluation at this time, but you will have an evaluation during your treatment. That specifically, you got a little bit of background on who these patients are and what their medical or their problem or impairment is, or health condition. So here you see cervical strain, limited active range of motion and strength, and muscle guarding along the cervical extensors. So you really need to, and these are going to be not, we're out to really provide you with objective data. So for example, if we're showing evidence that a person can only rotate their head 2 degrees with rotation in terms of using, well, the testing tool would be the inclinometer. That is a significant impairment to only be able to turn your head 2 degrees. Or subsequently, if someone is able to only extend their head 2 centimeters, I mean, that's pretty obvious that that person had a significant impairment into cervical extension. So it's not going to be gray, it's going to be pretty definite. So Finally, I just wanted to really emphasize looking at the SOAP note that we have that is open and visible, that this gives you an example of what a SOAP note would look like. You have had time to practice collecting data for the O, but this really mirrors the SOAP that you've been practicing in terms of what goes into an assessment, what an assessment may look like, and certainly what a plan will look like. These are the areas that I would continue to work on developing as you continue to improve in your data collection and your documentation. All right, I look forward to seeing you in lab next week and look forward to seeing some excellent treatments as we gather next Thursday, May 2nd. Bye.